Oh, what if everyone's noticing how nervous I am? What if something I say is embarrassing? What if my voice shakes? What if people can tell I'm nervous? What if they judge me? For someone experiencing social anxiety disorder, these thoughts can become incredibly powerful. Social anxiety disorder, sometimes called social phobia, is much more than simply being shy or introverted. It's a mental health condition involving intense and persistent fear or anxiety in social situations where a person may be watched, evaluated, or judged by others. And social anxiety can feel very physical. A person may experience a racing heart, sweating, trembling, blushing, nausea, difficulty speaking, or feeling that everyone in the room is paying attention to them. In this video, we're going to take a deeper look at social anxiety disorder, what it is, the DSM-5-TR diagnostic criteria, the symptoms, why it develops, how avoidance keeps it going, and the evidence-based treatments that can help. Most importantly, we're going to talk about what recovery can actually look like, because the goal isn't to eliminate every uncomfortable feeling. The goal is to help someone stop letting fear determine what they can and cannot do with their life. So, what exactly is social anxiety disorder? At its core, social anxiety disorder involves a significant fear or anxiety about social situations where a person may be exposed to possible scrutiny from other people. That could mean talking to someone new, meeting a group of people, speaking in front of others, eating or drinking in public, performing, answering a question in class, participating in a meeting, going on a date, or even making a phone call. One important distinction is that social anxiety exists on a spectrum. Almost everyone has experienced some degree of nervousness in a social situation. You might feel nervous before an interview or uncomfortable when meeting someone new. That alone does not mean you have social anxiety disorder. The difference is the level of fear, the persistence of the anxiety, and the impact it has on the person's life. Someone with social anxiety disorder may begin avoiding situations altogether. They may endure them with extreme distress, or they may organize their life around preventing situations where they believed they could be embarrassed or judged. And that's where social anxiety can become much more than ordinary nervousness. Let's look at how social anxiety disorder is diagnosed. According to the DSM-5-TR, one of the central features is marked fear or anxiety about one or more social situations in which the person may be exposed to possible scrutiny by others. The person is afraid that they will behave in a way or show anxiety symptoms that will lead to negative evaluation. In other words, the fear isn't simply, I don't enjoy parties. It might be, if I go to this party, people are going to notice how awkward I am, and then they're going to think something's wrong with me. The social situations almost always provoke anxiety, and the fear is generally out of proportion to the actual threat presented by the situation. Another important part of the diagnosis is that the social situations are avoided or endured with intense fear or anxiety. The symptoms also need to persist over time and cause clinically significant distress or impairment in important areas of life. And clinicians also consider whether the symptoms are better explained by another condition, a substance or medication, or a medical condition. So a diagnosis isn't based on simply checking a box that says the person gets nervous around other people. Clinicians look at the entire pattern: fear, avoidance, distress, impairment, duration, and the person's overall clinical presentation. One of the most important concepts in social anxiety disorder is fear of negative evaluation. This is a fear that other people are watching you, judging you, finding you inadequate, or forming a negative opinion about you. Imagine you're sitting in a meeting and your supervisor asks you a question. You know the answer, but suddenly you think, oh, what if I sound stupid? Then you become aware of your voice. You notice your heart beating faster. You wonder if your face is turning red. Now you're no longer focused on the question. You're focused on how you're appearing to everybody else. And that can make it even harder to speak. Another example might be someone who wants to make friends but thinks they're going to think I'm boring. Or someone who wants to date but thinks they're going to notice everything wrong with me. The important point is that the person often isn't actually afraid of people. They're afraid of what they believe those people might think about them. This fear of negative evaluation can become incredibly powerful because the person may start treating their own thoughts as if they're facts. Social anxiety isn't just happening in someone's thoughts. The body can become heavily involved. Common physical symptoms of social anxiety include a racing heart, sweating, trembling, blushing, muscle tension, nausea, dizziness, dry mouth, and difficulty speaking. Some people describe their mind going completely blank when they're nervous and anxious. Think about what happens during a presentation. Someone may have practiced what they're going to say several times. Then they stand in front of a group and their heart starts racing, their hands begin shaking. They notice everyone looking at them. They think they're going to see how nervous I am. That thought creates even more anxiety, and now their physical symptoms become even stronger. This is important because people with social anxiety disorder may become afraid not only of the social situation, but also of showing signs of anxiety. They might think if I blush, they're going to know I'm nervous. If my hands shake, they'll think I'm incompetent. If my voice trembles, everyone will notice. So the physical symptoms themselves can become part of the fear. One of the biggest things that keeps social anxiety going is avoidance. Avoidance means staying away from the situations that trigger anxiety. Someone might avoid parties. They might avoid speaking in meetings. They might stop going to restaurants alone. They might avoid dating, making phone calls, asking questions, or meeting new people. But there's another behavior we need to talk about: safety behaviors. Safety behaviors are things people do to prevent something embarrassing or threatening from happening. For example, someone might rehearse every sentence before speaking. They might constantly check their appearance. They might avoid eye contact. They might keep their phone in their hand so they have something to look at. They might only attend social events if a trusted person goes with them. Or they might speak as little as possible so they don't draw attention to themselves. The problem is that avoidance and safety behaviors can provide short term relief while actually strengthening the anxiety over time. The brain learns, I survived because I avoided the situation. So the next time a situation comes up, the fear can become even stronger. This is one reason effective treatment often focuses on gradually reducing avoidance rather than simply trying to make an anxiety disappear. This brings us to what I call the social anxiety cycle. Imagine someone receives an invitation to a work gathering. The first thing that happens is a thought: everyone's going to notice that I don't belong. That creates anxiety. The anxiety produces physical symptoms, maybe a racing heart or sweating. Then the person notices these symptoms and thinks, now everyone can tell I'm nervous. Anxiety increases again. The person decides not to attend, and immediately they feel relief. That relief is important because it reinforces the avoidance. The brain essentially learns that avoiding social situations made the anxiety go away. So the next time, avoidance feels even more necessary. This creates a cycle: fear, anxious thoughts, physical symptoms, self monitoring, avoidance, short term relief, stronger fear the next time. Understanding this cycle is incredibly important because treatment can begin by interrupting it. Instead of automatically escaping anxiety, the person learns to tolerate it, challenge unhelpful thoughts, and gradually approach situations that matter to them. So, what causes social anxiety disorder? Well, there isn't a simple answer. A useful way to understand the causes of social anxiety is through the biopsychosocial model. Biologically, genetics can influence vulnerability to anxiety. Brain chemistry and the way the nervous system responds to perceived threats may also contribute. Psychologically, anxiety sensitivity can play an important role. Someone may become highly focused on physical signs of anxiety and interpret them as evidence that something is going wrong. Catastrophic thinking can also contribute. For example, if I make a mistake, everyone will remember it. If I blush, people will think I'm strange. If I don't know what to say, I'll completely embarrass myself. Then there are social factors: chronic stress, bullying, trauma, rejection, difficult family experiences, or major life changes can influence how someone responds to social situations. So, social anxiety disorder is not simply a matter of someone being weak, shy, or lacking confidence. It's a complex interaction of biological vulnerability, psychological patterns, and life experiences. There are also several risk factors for social anxiety disorder. Having a family history of anxiety or other mental health conditions can increase vulnerability. Chronic stress can make the nervous system more reactive. Trauma and experience of rejection or bullying may influence how someone expects other people to respond to them. Major life transitions can also be challenging. Think about starting college, beginning a new job, moving to a new city, ending a relationship, or entering an environment where someone doesn't know anyone. These situations can create opportunities for existing social fears to become more pronounced. Other anxiety disorders can also occur alongside social anxiety disorder, and it's important to remember that risk factors don't mean someone will definitely develop the disorder. They simply help us understand why some people may be more vulnerable than others. So, how is social anxiety disorder diagnosed? Diagnosis generally begins with a clinical interview. A mental health professional, like myself, will want to understand what situations trigger anxiety, what the person fears will happen, and how long the symptoms have been present, and how those symptoms affect everyday life. The clinician will also assess avoidance. Are you avoiding work meetings? Are you avoiding dating? Are you avoiding friendships? Are you avoiding school presentations? Are you changing your routines because of anxiety? The clinician will compare the presentation with the DSM-5-TR diagnostic criteria and consider whether other mental health conditions could better explain the symptoms. Standardized assessment tools may also be used to help measure symptom severity. The goal isn't simply to give someone a label. A good assessment helps identify what is actually happening so that the treatment can be targeted to the person's specific needs. The good news is that social anxiety disorder is treatable, and there are several evidence based approaches. One of the most well supported treatments is cognitive behavioral therapy, also called CBT. CBT helps people identify patterns of thinking that contribute to anxiety and learn more balanced and effective ways of responding. But for social anxiety disorder, exposure is especially important. Exposure therapy involves gradually and intentionally approaching situations that create anxiety rather than continually avoiding them. Imagine someone who is terrified of speaking in front of a group. Treatment wouldn't necessarily begin by putting them in front of 500 people. It might start with something much smaller, perhaps making eye contact, saying hello to somebody, asking a simple question, or speaking briefly in a safe environment. Then the difficulty can be gradually increased. The purpose isn't to prove that anxiety will never happen, it's to help the brain learn I can experience anxiety and still be okay. Medication can also be appropriate for some people, including certain antidepressant medications that can help reduce anxiety symptoms. Medication decisions should be made with a qualified medical professional based on the individual's needs and circumstances. In many cases, therapy, exposure, skills practice, and medications can work together. The goal is not to simply feel less anxious, the goal is greater freedom. Recovery from social anxiety doesn't necessarily mean that you'll never feel nervous again. In fact, that's an important distinction. The goal is not to eliminate anxiety. The goal is to stop anxiety from controlling your decisions. Someone recovering from social anxiety might still feel nervous before giving a presentation, but instead of thinking, I can't do this, they might think instead, I'm anxious and I'm going to do it anyways. That is a major shift. Treatment can help people challenge anxious thoughts, gradually face feared situations, build supportive relationships, practice mindfulness, and develop healthier routines. Exercise, adequate sleep, stress management, and social connection can also support overall mental health. And perhaps most importantly, recovery involves developing a different relationship with anxiety. Instead of constantly asking, how do I make this feeling go away? The question becomes, what matters to me and what am I willing to do even when anxiety shows up? That's where meaningful change begins. One of the most important messages I want to leave you with is this. Social anxiety does not define you. Having social anxiety doesn't mean you're antisocial, and it doesn't mean you're weak, doesn't mean you're incapable of relationships, and it certainly doesn't mean you're destined to live your life avoiding people. A person with social anxiety may be thoughtful, funny, intelligent, compassionate, creative, successful, and deeply interested in connecting with others. Sometimes the problem isn't that they don't want connection, it's that anxiety gets in the way of connection. And that's something that can be worked on. Recovery often happens through small steps, one conversation, one uncomfortable situation, one challenge to an anxious thought, one decision not to avoid something simply because anxiety showed up. Those small steps can eventually create a very different life. Let's clear up a few common myths about social anxiety disorder. Myth number one: social anxiety is just shyness. Not necessarily. Shyness can be a personality trait or a temporary feeling. Social anxiety disorder involves clinically significant fear, anxiety, avoidance, or impairment. Myth number two: people with social anxiety don't want friends. Many people with social anxiety desperately want meaningful relationships. They may simply fear rejection or embarrassment so strongly that connecting with other people becomes very difficult. Myth number three: someone with social anxiety just needs to get over it. Telling someone to just get over it doesn't address the underlying anxiety cycle. Social anxiety disorder is a legitimate mental health condition, and evidence-based treatment can help. Myth number four: you can tell who has social anxiety. Not always. Some people become extremely good at hiding their anxiety. They may appear confident while experiencing intense distress internally. And finally, myth number five: medication is the only treatment. Although medication can be helpful for some people, therapy, particularly CBT and exposure based approaches, are the very important part of treatment for most individuals. The important thing is getting an appropriate assessment and finding treatment that fits your personal needs. If someone you care about has social anxiety disorder, your first response can make a real difference. First, be patient and understanding. Avoid mocking or minimizing their anxiety. Saying, there's nothing to be nervous about, may seem reassuring, but it can accidentally communicate that their experience doesn't make sense. Instead, you might say, I can see that this is really difficult for you. Second, listen without judgment. Give them room to talk about what they're afraid might happen. Third, encourage rather than pressure. There's a difference between supporting someone as they take a difficult step and forcing them into a situation they're not prepared to handle. Fourth, celebrate small wins. If someone who normally avoids speaking up asks one question in a meeting, that may seem small to someone else, but it could represent a major accomplishment for them. And finally, try not to reinforce avoidance. Support should help someone move towards greater independence, not unintentionally make avoidance easier. Sometimes the most helpful message is simply, I'm here with you and I believe you can do this. So when should someone seek professional help for social anxiety? A good rule is you don't have to wait until your life is falling apart. Consider reaching out when fear or anxiety becomes persistent, when you're regularly avoiding important situations, or when anxiety is interfering with work, school, relationships, or everyday activities. You should also consider professional support if social situations create significant emotional distress, or if you feel like your world is becoming smaller because of what you're avoiding. Here's a simple question you can ask yourself: is anxiety making decisions for me? Am I not applying for that job because I might have to interview? Am I avoiding dating because I might be rejected? Am I not making friends because I don't know what to say? Am I avoiding opportunities because I might embarrass myself? If anxiety is consistently making those decisions, it's worth talking to a mental health professional. Getting help isn't a sign that you're weak, it's a step toward having more choices. Let's bring everything together. Social anxiety disorder is a real and treatable mental health condition. It's more than just being shy. It involves significant fear of social situations and negative evaluation. It can affect relationships, work, school, and everyday life. Social anxiety can involve both psychological and physical symptoms. Avoidance and safety behaviors can keep the anxiety cycle going. And while biological, psychological, and social factors can contribute to social anxiety disorder, effective treatment can help people interrupt that cycle. CBT, exposure therapy, medication when appropriate, and practical coping skills all play important roles in recovery. And recovery doesn't mean you'll never feel nervous again. Recovery means anxiety no longer gets to decide what you're capable of. If you found this video helpful, I've created a free social anxiety educational handout that goes along with this presentation. You can download it through my Shopify store and follow the Quiet Mind Counseling for more educational videos covering mental health diagnoses, coping skills, psychology, and evidence-based treatment strategies. If social anxiety has been in your life, remember this. You are not your anxiety. You can learn new skills, you can build confidence, you can develop meaningful relationships, and you can build a life that is bigger than the fear. I'm Daniel with The Quiet Mind. Thanks for watching.